But before I close, I just want to make a few observations based on what's been a long career in terms of international public health, and some observations that, while they won't take long to make, I think have been useful to me. First thing is to appreciate that things are so much better in 2015 than they were in the late 1970s when we first got started with the establishment of WHO's expanded program on immunization. In the early 1980s, remember, there were only 12% of the world's infants who were receiving EPI vaccines at that time. In 2015, that number is 80%. That is an astonishing accomplishment, because it means in each one of these countries there had to be an infrastructure established that extended out to the furthest villages to be able to provide EPI vaccines for newborn cohorts. And that as an accomplishment has really, in many countries, or in most countries, established a bedrock where those programs have served as an infrastructure for other activities that are health-related activities. And this enormous effort, I think, has really not received anywhere near the recognition that it deserves, because it really has represented over a generation and a half, really an entire sea change on how global birth cohorts are managed. None of this has happened easily, and there are these ups and downs. There's always something. There's Ebola, there's corruption, there are wars, there's everything that always goes wrong in terms of trying to get in the way of what you're trying to do with international public health. But I close with what I think is important in terms of a distillation of what's necessary for something to work. And I just offer 4 observations. Number 1, the science has to be correct. No matter how much money you have, if the science isn't there, if the data are not there, if the evidence is not there, to make sure that what it is that's being done is not correct, whatever happens isn't going to work. Secondly, my advice is to always seek partners who have a long view. And when I talk about partners with the long view, I'm talking like about USAID. We're talking about development problems and issues that really span over 10, 20 years. That's the amount of time it takes to actually make some of these changes over a period of time. That takes special partners. It's not done over 2 years or 3 years. The third issue is, to do this kind of work, you have to be patient. Sometimes a success is determined by waiting until somebody retires so that you're able to do something that you know needs to be done. And recognizing that is just as important as identifying a sort of new product. And lastly, I think it's important to be optimistic. There are times in international public health, and those are the best of all possible times, when country needs and country activities are linked well with what donors perceive as appropriate endpoints. And when that happens, the amount of energy that can be generated is phenomenal. Doesn't happen often. More often than not, there are misunderstandings that occur, and it's really sort of hard. But occasionally you get to that sort of sweet spot. And that's what we found with Menafrovac, is we had an affordable product, a major medical issue that, frankly, the Africans were very, very tired of. And being able to sort of help put those partnerships together so that that could be achieved was really a wonderful experience for myself, and something that I'm grateful and will always be grateful for in terms of African countries, donor agencies, and frankly, everybody. Thank you.